All right, Eileen. So first of all, let me thank you for allowing us to take this opportunity to actually share your story with other doctors and help them as part of their learning process. And I mostly want to thank you because number one, you're taking something invaluable out of your life, which is your time, to actually do this. So I teach my doctors that there are two things we cannot buy, and that's health and time. And health, we took care of it yesterday when we did this microsurgery. And time is what you're giving us now. So this is why I want to make sure it's clear that we are very grateful to you for your time. And then last, before I let you take over, is that I want to thank you for your permission to share this, on to other doctors. And we have a platform on Facebook where doctors are learning from me. And this is why I'm very appreciative that you give us the permission to do that. And it's done in with all the respect and so forth. It's in the goal of learning. So having said that, I would like to pass this on to you. And my first question to you is, how was the pain after the microsurgery? And the context is we're not even 24 hours after the treatment. We're less than that. So please tell us how it was after you left here and until we just saw you just now.
Well, Dr. Lin, I am so happy to share my experience. I decided that I would take the chance, and I was so confident in the doctor too. And so after he sent me home with an ice pack and asked that I would do 20 minutes on and 20 minutes off.
Wow, beautiful.
And when I did, I could see that it was a help. And little by little, the medication was wearing off. And I began to feel some pain on that side of my mouth, so that I didn't want to eat on that side of my mouth.
Sure.
But it wasn't overwhelming at all. He asked me to give a number, and I would say maybe 4.
Okay, 4 out of 10.
4 out of 10.
Okay.
And that was on my way to bed. I had only 2 ibuprofen. When I left the office, several hours. I left the office at 5. And this was about 9. And I went to bed, and I slept well.
Excellent.
I found a comfortable spot in the bed, and I had a pillow, and I slept all except when I woke up from my penicillin.
I see. Beautiful. So just to clarify for these doctors, so I give anesthesia as usual with lidocaine, and then
Yes.
that's when you mentioned the medication wore off. There was the numbing that wore off.
Yes.
And that's when you then felt it was 4 out of 10. And that's
Yes.
when you took the 2 times 200 milligrams of ibuprofen, the 2 pills, right?
That is correct.
So that was 400 milligrams at 9 o'clock, which is about 4 hours later after you left the office.
Yes.
Yes.
I took those pills at 5 o'clock. 2 ibuprofen. And then I did not take any more.
I see. Oh, so maybe I misunderstood. You took these as you were leaving here, or
I took that as I left this building.
I
the
see.
office,
I see. Okay.
And that was all that I took.
I see. So when you had the 4 out of 10, you kind of left it as is. You didn't take any additional pain medication when
No,
it.
I did not.
I see. Then I misunderstood. So you took 400 milligrams as you left here,
That is
and then
correct.
it went up to about a 4 out of 10, and then you eventually went to bed without taking anything else.
That is correct.
Wow. And then you then slept through the night, but you only woke up not because of the pain, but because you needed to take the penicillin
That is correct.
as a precaution. Okay. Beautiful. And then this morning you woke up and you told me, what was it, the level of pain this morning, Eileen?
I had no pain this morning.
You had no pain.
But you could press your hand on my the lower cheek, and I felt like it was bruised.
Okay. So everyone remember that we are early afternoon here. So as you heard, Eileen, she left at 5. So we're about 20 hours after the treatment, not even a day,
Yes.
And at this point, we took some photos and we saw that the wound is healing already really, really well.
Yes.
And that's part of, as I mentioned, that's part of your great attitude, and healing is connected to our spirit, you know, and how
Yes.
positive we are.
Yes.
Now, what else would you like to share about your experience? Because this tooth has been a long journey. You know,
Yes, it has.
there was an infection. I did a root canal. It took care of part of it, and then yet we still had to go and do this microsurgery.
Yes.
You know, so please share your story and your experience as a patient, because ultimately I appreciate the trust you put in me, because
Yes.
you and I are going in this together, right?
Yes,
But
yes.
from your standpoint, what else would you like to tell the doctors here listening?
Well, I just would like to tell the doctors listening that they should encourage their patient in this manner, because this isn't anywhere near as bad as a toothache. If you have a toothache, you can't get rid of it.
That's right.
And this heals quickly. And also, I just think that I am so thrilled and thankful that I'm on the way. Today, the doctor told me that the gate was closed.
That's, and I'm referring to the incision lines, doctors. I was explaining to Eileen that if the wound is still open and the doors are still open, bacteria take advantage of that, you know. And today we took the photos and we see it's already healed, and so the gates are closed. So very, very nice. And we want to thank Dr. Rogers in the whole process, because had he not believed that this tooth was worth saving, you know, you wouldn't have even come and seen me,
That is
right?
correct.
So Dr.
That is
Rogers
correct.
is at the very beginning of this whole journey. And then
Yes.
it took you to trust me, to
Yes.
trust me, the Indian, and then trust
Yes.
my equipment, the arrows, right?
Yes.
To ultimately end today to this good conclusion. Now,
Yes.
we still have a date in a month
Yes.
to check on bone healing, right?
Yes.
And I explained to you how quickly it can be visible. So that's truly the ultimate test, is to graduate you from the program.
And Sako Jovia is very happy.
See, that's right there, the attitude I was referring to. Is if healing is going to be faster, it's because you have a wonderful attitude. Maybe last word for the doctors, and actually it's not just doctors, Eileen, it's also patients out there, right? Wondering,
Yes.
you know, should I save my tooth? I'm scared.
Yes.
I hear the word
Yes.
surgery. So what's the last word for doctors and patients out there?
Well, the patient, don't be afraid. Don't be afraid. Trust the doctor, and doctors encourage your patient to take the step.
Oh, beautiful.
They'll be glad they did.
Thank you again for your time, Eileen. This is going to go a long way, and you're just part of a whole process of changing the face of dentistry. Thank you very much.
You're so welcome.